Commercials for prescription drugs have to warn about potential side effects. In fact, in some ads, these warnings take up most of the airtime. Trulicity trademark is no piker when it comes to reasons you might want to choose a healthy lifestyle instead. Eating fruits and vegetables and taking a few walks has to be easier than some of the stuff that could happen if you rely on this, or most other prescription drugs to treat your diabetes. In fact, Trulicity is one of many prescription drugs that should be packaged in a child-proof, locked, hazardous material, steel container, complete with a skull and crossbones. If you have diabetes, you will submit to an occasional blood test to monitor your A1C. This test tells what your blood sugar has averaged over several months. If it is high, your doctor will prescribe medicines to lower your average. Trulicity is one of those prescriptions. Diabetics are subject to congestive heart failure and kidney disease. They can also lose their eyesight and develop a painful condition called neuropathy. If diabetes is poorly controlled, gangrene can result. This means tissues die. The only cure for a gangrenous limb is to cut it off. Along comes our friends at Lilly Registered Trademark with a product that will not only lower your A1C, but will also, wink wink nod nod, probably help you lose weight, even though it really hasn't been approved for that. Since weight is a problem for many diabetics, this additional promise might have special appeal. Trulicity trademark isn't insulin. If your body can produce some insulin, but not enough to keep your blood sugar normal, drugs like Trulicity trademark might be prescribed because they force the pancreas to produce more. In this way, the drug theoretically stabilizes the diabetic's A1C and consequently his blood sugar. Trulicity trademark is easy to administer. It comes in a pen that the patient injects into his belly, thigh, or the back of his arm. One dose takes 5 seconds. Then he is free to put the used pen into a sharps box and call his local authorities for instructions on how to dispose of it. If you think disposing of toxic pens is bad for the environment, wait until you hear what can happen to a person who injects the stuff. First, we'll talk about people who shouldn't take Trulicity trademark. If you or a family member have had medullary thyroid cancer, Trulicity trademark is not right for you. If you have ketoacidosis, you better take a pass. Finally, if you are allergic to its ingredients, Trulicity trademark could make you miserable. Okay, I have a couple questions here. Does a doctor test you for ketoacidosis or medullary thyroid cancer before prescribing the poison pen? And pray tell, how will I know whether I am allergic to the stuff before I take it? Just think. If you dose yourself on Monday and you are allergic, you will suffer a reaction for a whole week or longer. What are you supposed to do except call your doctor if... And what's more to the point, what is your doctor going to do? Will she admit you to the hospital? Maybe there is a drug to counteract the allergy, and if you're real lucky, it will come in a convenient, easy-to-use toxic pen. If you don't have an allergy to Trulicity trademark, don't feel bad. You'll still have ample reason to call in sick. Common side effects include rash, diarrhea, and vomiting. You can also get lumps and become short of breath. Finally, your kidneys can take a mighty hit that could land you on dialysis. As you can see, the side effects to Trulicity trademark can cause as much suffering as the disease itself. But, gentle reader, there is a possible tragedy that the FDA hasn't warned consumers to avoid. Picture this. A very pregnant woman is sitting in her living room watching the Trulicity trademark commercial. Suddenly, her face lights up with the joy that only those who have finally solved a vexing problem experience.
Honey,
She screams joyously.
I know what we can call the baby.